We speak to Dr. Bruce Young, nuclear physicist at Theramed Nuclear, for more. A very good evening to you. Thank you so much for your time. I mean, an important day to mark as we take a look at the impact of cancer and some of the statistics around cancer. The Charter has now spoken, the theme, is united by unique. Perhaps expand on that a little bit and let's talk about the importance and relevance of such a theme.
Thank you. Thank you for having me. Yeah, it is a useful theme to talk about, and what we're trying to do in our cancer journey and dealing with our patients is put them at the center of the journey. So united by unique is a call to put the patient right at the center of the cancer journey and build the cancer journey that they experience from diagnosis all the way through to treatment around them and their experience, and personalizing the treatment to their specific needs. So it's a lovely phrase.
What does personalizing entail? Are we talking here the different kinds of cancers, the different kinds of treatments, instead of putting it all under the same box? I mean, what would personalizing it and making it a unique experience mean for the patient who is fearful of losing their life, but also perhaps at the same time possibly hopeful that they will overcome cancer?
So I think if we take the whole cancer journey that the patient experiences from the diagnosis, they have their own experience around that, learning about the diagnosis, understanding their disease. But what we can bring as doctors to that is a deeper understanding of the cancer that the individual is suffering from. So, for example, my modalities, PET-CT, can describe the cancer and give us a wonderful understanding of the disease itself, which is unique to that patient. Then throughout the cancer journey, picking the right chemotherapeutic drugs, for example, designing a radiotherapy treatment plan, which is a treatment which is designed to shoot X-rays into a tumor and kill it, very specifically to the size of that patient's tumor, the location of that patient's tumor, and designing those treatments very specifically to deal with the patient's concerns. So at every stage of the journey, we make the best decision possible based on the unique and detailed information we have about the specific patient's disease.
As you talk about that, what sort of loopholes does that open up, or perhaps amplify about some of the challenges within the healthcare system when it comes to cancer treatment, how patients are treated, and also looking at the entire journey on what room there is for improvement and bettering their experience?
So we've got lots of problems to solve in our medical community, as you know, and I think we can solve each of these problems. So, in my specific field, which is an imaging specialty where we're focusing on cancer diagnostics and understanding and describing cancer as best as we can, I know my challenges are that we don't have enough of this PET-CT technology around the country. So there's vast swaths of the country that don't have access to the technology that I'm providing or my community is providing. And that extends into the other areas of care, whether it's chemotherapy or radiotherapy, and even the whole of the multidisciplinary team that manages cancer, expanding on to the surgeons, the dietitians, the psychologists, the social workers, et cetera, et cetera. So number one, I think, is getting these services that we offer to where the people who need them are. And, I'm not the driver of this journey. It's the patient at the center of it, dealing most directly with the oncologist and who's going to direct their care. And we like to say we'd like to give the tools that the patient needs, that the oncologist needs, when they need it, where they need it. So access is of fundamental importance. And you touched on something earlier, which is that, we don't always have the treatments funded or the diagnostic workups funded for these patients. And, these two facets of the cancer care journey go hand in hand. So if we can work with our healthcare funders to assist in covering the cost of these new technologies and these wonderful personalized treatments that we have available for patients, which are here in South Africa, all around us, just perhaps not as widespread as we would like. If we can work with our funders to encourage them to fund these treatments and these technologies, then we can, get those tools and get these technologies and this world-class cancer treatment to our patients where they are, when they need it.
The other shocking revelation here, according to some of the estimations from the WHO, is that by the year 2050, there will be an 85% increase in the number of new cases and deaths. I mean, which now brings me to trying to get a better understanding of why is this? What are the contributing factors? What is science saying about this increase? Where do we look to? What do we do to stop that from happening?
So you have taken me a little bit out of my comfort zone here. To be fair, I mean, I'm focused more on the treatments and the diagnosis of these cancers. I mean, I know these statistics as well as you do, that the incidence of cancer is increasing year on year. So we're discovering more cancers that patients are suffering from. As patients get older and older, they suffer from more and more disease. I don't know the levers to pull to reduce those numbers over time. I'm sorry, I can't give you the answers you're looking for.
That's fine. That's fine. You touched on how more older and older patients are getting diagnosed, but since 2022, there are younger patients which are also getting diagnosed there. I mean, how in terms of symptoms would a parent or guardian know that perhaps the problem here would be cancerous? Perhaps talk to us about some of the experiences with the younger people you've had to treat and what that journey has been like.
So, diagnosis starts with a symptom. And it doesn't matter what age you are. If you're experiencing something which is out of the ordinary, I would strongly encourage you to go and attend one of your primary care practitioners and discuss it with them and explore that, because God forbid it could be cancerous, and the earlier we find the disease, the less likelihood it has of spreading elsewhere in the body, and the better chances we have to have a successful treatment outcome for that. So I don't have specific advice for an individual, but engagement with the healthcare sector, I would strongly encourage. And if you or your loved ones notice any strange symptoms or lumps or bumps, please just attend your local GP or your local primary care facility and discuss it with them. And that's your first entry into this world of cancer diagnosis. So first step is make the diagnosis, and that's always going to start at your first point of contact with the healthcare system. So I encourage all our patients and all our listeners to go and see and discuss their problems with their providers. Once you're inside the journey, that's where we are now going to talk about your unique cancer journey, united by unique, and giving you the personalized attention that you deserve and the best possible understanding of your disease, how it's spread, how it behaves, and how to treat it. And that's where we can improve our outcomes for our cancer patients.
Yeah, thank you. Thank you so much for speaking to us this evening. We're going to have to leave our conversation right there, speaking there to Dr. Bruce Young, a nuclear physicist at Theramed Nuclear, talking about World Cancer Day.